Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. My name is Caroline, and I am a family nurse practitioner here at Fiat Integrative Health in Franklin, Tennessee. And today I'm joined with Dr. Ed. How are you today?
Doing well. Looking forward to this conversation.
I'm excited. I think it's fun because Dr. Ed and I have lots and lots of fun conversations throughout our week and just working together. So I think it's really fun for everyone else to just be able to sit in on these fun conversations that we get to have.
Absolutely.
So today's topic is going to be very fun, I think. We're doing some trendy, hot topics that we see on social media as well as patients bring to us as like, what should I think about this? And generally, I feel like I've shied away from not deep diving. I certainly do deep dive, but I don't like to be trendy. I don't know about you, but...
I wouldn't say trendy, but I do like to keep one foot in the future at all times.
There you go.
Looking for the bleeding edge.
There you go.
Not just the cutting edge.
Exactly. But yeah, so we're just going to tackle today Parasite Cleanses, because that gets brought up a lot to me, at least, especially in kids. I think that marketing's going around right now. And then peptides.
Therapeutic peptides.
All right. Super fun. Okay. So I think just to set the stage, our approach, which we'll come back to probably many times over this podcast, is one of good stewardship. And so I think that's really where our heart is how can we steward our own bodies and also partner with our patients to steward their bodies well. And it's really hard to navigate this age of over-information and of social media and of constant things to navigate as a parent, just for your own health. And so, again, we're just always going to bring it back to how do we steward this well, both the information and our own bodies in this day and age. So, and one of the main things for me, at least, is like, if this is stealing your peace, just step back right now. Make no decisions when you're in a place of fear, when you're in a place of panic. Always give yourself time and just like turn off Instagram for 3 days. Step away from Twitter before you hit any buy button, before you make any big decision for your family. So that's my one nugget.
Completely agree. And I always also say, bring it to prayer. When we are healthcare or health is always a concern of every one of us, but we become perhaps put blinders on as we add more constraints like fear and time, and maybe there is time, and meaning this is an urgent decision, etc. It's never too late to stop, pause, pray, and listen for that response. And as we do, as we're talking with patients, and making sure that this is truly having the true physician guidance from God. So.
Yeah. And a lot of work that we do, we're not in an emergency room.
Right.
And we're not in ICU. And so a lot of the work is like, hey, like this isn't emergent. Like it's giving that peace and that calm of like, it's okay to slow down for a minute to make this decision.
Yep.
Even though it feels urgent. Okay, great. So I'm going to jump into parasites. Really fun.
Yay.
Love worms. So I want to give like a quick overview of like, what is a parasite even? Like, what does that mean? Because as healthcare providers, I think we take that for granted maybe for the general population. So very, very loosely, a parasite is an organism that lives off a host. So a parasite can't live on its own. It has to have something to live off of. And that is like the very general definition of it. When we talk about parasites in medicine, there are two main ones that we look at in the gut, especially, and that would be something called helminths. So that means like the actual worms. So that would be pinworms, roundworms, hookworms, tapeworms. And then there's something called protozoa. And so protozoa are a single-celled parasite. So that is just tinier things. You wouldn't be able to see these in like your stool ever because they're teeny tiny. And so Parasites in general, they spread through contaminated water, through contaminated food, poor hand hygiene, in the soil, undercooked pork maybe, or wild game. And it is more rare in the US to find a true pathogenic parasitic infection. And what I mean by that when I say pathogenic is that it's causing real symptoms, right? So I have had a patient with Giardia before, which is found in contaminated water. So you could get this if you're swimming in creeks or out camping. This particular patient drank out of a hose after it had been like sitting in warm summer and had bloody stool, diarrhea, extreme abdominal pain, right? We test the stool, it comes back with Giardia, and we treat it.
I've had that.
Have you?
In Peru.
Oh my gosh.
Yes. I did medical missions Central and South America.
Okay.
And Peru, I have very clear memories of the instant it occurred.
Distinct memories.
And then exactly when I knew what was going on.
Oh my gosh. So yeah, I mean, certainly no one's sitting here saying parasites aren't real.
They are very real.
They are very real. What I think we're going to see is when do they matter, I think is a real question that we want to get to. So you have a true pathogenic infection, which is obvious, and you're going to go to your doctor, and there's really no question for that. I think what we find in social media is this underlying parasites are causing all these vague symptoms, maybe. So you've got bloating, fatigue, brain fog, behavioral issues. I see that one a lot with kids, or marketed towards kids with behavioral issues. And you've got this great story about all these problems were solved when I did this cleanse. Therefore, everybody should do a cleanse, because it's like this perfect little cycle of like, you can't diagnose it, therefore, and everybody has it. And so it's the perfect product because everybody has to take it.
Exactly. There's no way to prove that you have it unless you take it and you get better. Therefore, it proved it.
It proved it. Exactly. And so I think just even, I find myself getting into those like cycles, even as a healthcare provider of like, yeah, I did eat salmon or like something, or my kid is having like behavioral issues. Like this, you want so badly for there to be an easy fix. Even me, I'm like, that would be really great when my 4-year-old's throwing this huge emotional tantrum. Like maybe I should just give him some herbs and that'll make it all better.
Yes.
And I think that, marketing really tends to hone in on our
vulnerabilities.
Yeah. Exactly. So just a couple quick things I wanted to, like 3 things of warning flags that I would say are like, maybe we should pause before, again, I hit any buy button, is language. Any quick fix language should be a cue of like, this is maybe a red flag and I should look into this more. I'm not saying you shouldn't do it. I'm just saying you should probably research into this product before we just go and buy it. So if this is a cure-all, everybody needs it, and this is going to fix all your problems, major red flag. I would say another one is like dramatic photos or testimonials with nothing to back them, right? And this is like a real pet peeve of mine for a lot of these companies, is that it actually wouldn't be that hard to prove what you're saying. It wouldn't be hard to collect stool samples and show that they are parasites and have literature to back it up. I'm not even asking for huge studies. Like any small study would be good, but they don't. They just rely on a photo from a mom that may or may not be a parasite that they're claiming to be. So that would be another thing, is just dramatic stories, dramatic photos that pull at your heartstrings, but have no evidence behind them. And then the last thing I would say is any urgency, right? Like it has to be done now. And this is going to only last for 48 hours before the sale leaves or whatever. Like just pause. So that'd be one thing. And then off that kind of same, with going back to like the photos people post, this one really gets me because it can be very convincing, right? You're like, oh my gosh, look what I found in my stool. And it's not that I don't know, I didn't test your stool. Maybe it is a parasite. But there have been people who have sent off those things that they find and actually find that it's not parasites. It's actually just your intestinal lining that looks like a rope, like it looks like a substance that could very easily be mistaken for parasites. Another thing that's commonly used is like mimosa pudica is a common herb that's used in parasite cleanses. And it creates this gel-like substance in the stool. And this is well found in the literature. And so people are like, oh, but I took it and my stool changed. It's like, well, of course it did.
Because that's what it does.
That's what it does. That doesn't mean that you just let go of all of these parasites or anything like that. So those are just words of warning in my little soapbox about all these cleanses that are marketed. I think also something to note is that the herbs that are put in these cleanses, I don't think they're really necessarily harmful a lot of times. I don't know if you have a differing opinion, but I would say, they have very broad spectrum effects. So it's very common that you're going to feel better. Was it because you got rid of parasites? I mean, maybe, but it also could have been that they have anti-inflammatory effects. They have antimicrobial effects. So maybe you actually had, a little bit of an overgrowth of staph in your gut. And by taking these herbs, we decrease the inflammation. We decrease that, we helped your microbiome. Great. That's great. That still doesn't mean that it was a parasite.
Exactly. Yeah. I think a couple things that I think of, I mean, we were taught in early school for healthcare that you just send the stool for ovo and parasites. You look for eggs, you're looking for parasites. They do that. That is a standard mechanism by which we have done this for 30 years. And when you simply bypass 30 years of experience and say, yep, but here's a new way to do this, but don't take the steps to make a true evidence-based study on it, that's where we should pause and consider. Obviously, it doesn't mean that, as you said, that none of the treatments work. Not calling it a parasite, yet still treating it, still may come up with the same result.
Sure.
But if there's no evidence for a parasite, maybe we should not be calling it that, but it doesn't mean that there's no treatment available.
Absolutely. And I think also something to consider is like, are we just delaying actually treating the problem by doing a parasite cleanse? And I think where this falls most of the time is it's not an issue because it's probably something mild, right? I've got mild digestive issues or mild behavioral problems, and I just want to try this parasite cleanse that I saw on social media. Like, sure, you could do that. But at the same time, if you've got real problems, you could be delaying finding the real answers to those issues by buying into something. And now you've wasted your money and your time. And that can be significant for some people. So just another little caveat there. So one last thing I want to say just about parasites that I find really fascinating, because what has always not resonated with me with all of these parasite things is that like parasites have existed for a very long time. And God created us not to live completely separate from the soil and completely separate from animals. So this idea of like, oh my gosh, there's a parasite, therefore like cleanse. Like we're supposed to be so clean or something. And there's a hypothesis for this called the old friends hypothesis. Are you familiar with
No.
this? Okay. It's kind of like the terrain theory a little bit of like your gut microbiome is not meant to be like sterile, right? Or not meant to live in a sterile environment. And so the old friends hypothesis just suggests that for most of human history, we've lived essentially in conjunction with parasites, with bacteria, and that they actually help us and train our body to respond appropriately, right? So there's actually research right now, and it's very small, but where they're using parasites to help chronic disease. So they used it in Crohn's. There's a case study. And what it does is the parasites upregulates your T cells, right? So it wakes up the immune system and says, hey, I need to be alert and awake. And part of the, some of the theories with chronic disease, such as asthma, eczema, is that our bodies are attacking themselves. And so when you give it something to attack, like focus its attention elsewhere, then it's able to do what it's supposed to, right? Our body was made to do that. And so the idea is that since now we have this sanitation and we live in a very clean world, our bodies are overreactive, right? And that's contributed to the rise in those chronic disease. So it's just really interesting that in reality, a lot of us do live with, we live with funguses, in our gut. We live with bacteria, and there are low levels of parasites that we're supposed to live with, and yes, there can be an overgrowth of them and they can cause issues. Absolutely. But in the end, we can't actually just live in partnership with them, and the marketing towards they're not supposed to be there, I think is actually harmful.
Yeah, I love that. What was fascinating to me, and I never put it together, but we actually have, 27 billion something cells in our body. And there's actually more bacteria that coexist with us than our actual human cells.
Oh, interesting. Yeah.
Yes. So if you look at us as human beings, for those of you who are wiser in their 50s and 60s, they'll remember The Boy in the Bubble was a television show, a movie
okay, yeah.
On TV. And obviously The Boy in the Bubble, the story was that he had an inability to fight infections. So he had to live in this bubble. Otherwise, he would die from infections and because he didn't have the ability to fight these. That is the abnormal. The norm is not only do we live amongst the fungi and the parasites, they live amongst us and live inside of us, and they are training our immune system. They're actually, a fundamental function. And even more unique to that, the thought around what are mitochondria. And could mitochondria have actually started off as one of these bacteria that became so important to our ability to create energy that they simply subsumed their role into our cells to do that. So we are not meant to live in a sterile environment, and our cleanses safe. They seem to be. I don't see people. I see a lot of people doing cleanses, and I don't see a lot of people going to the hospital from these issues and these cleanses. Are all cleanses the same? No, absolutely not. So yeah, I think they may be relatively safe, but I also think that most of them are a shot in the dark. And the scientific method, we'll put that on the shelf over here. And sometimes we kind of need to do that. I've done that recently with vagal nerve stimulators.
Yeah. Why not?
I like to try things that are out there.
Yeah.
We'll have a different podcast on that, I'm sure, coming up. But so if it seems benign and you can afford to do it, I see that's perfectly fine. But we can't run healthcare completely like that.
100%.
Let's see what sticks on the wall and what doesn't. There's some room for that bleeding edge, but we have generations of passed down information on how we can improve patients' lives. So I think we need to keep a firmament in that right. History.
And I think just an informed decision, right? I'm not making this decision out of fear. I'm making it knowing that I may or may not get the result I want, and this is uncharted territory, and I'm okay with that, right? And sure, let's try it. Why not? Like you said, there's probably a little harm to it, but I don't want people making decisions out of fear and out of this idea that it's a magic bullet.
Right.
Okay, now that I'm off my parasite soapbox, tell me all about peptides.
Peptides. So I think we're going to see a lot more information come out very soon around peptides, and I'll kind of set the stage for why we're going to see that. But first, what are peptides? So you can kind of think of building blocks for communicating. For us, it starts with words, and then we have phrases, and then we have sentences. It's the same thing in our body with protein. So if you think of a protein as a complete sentence, and if you think of each word as being amino acids are put together to make phrases, which are called peptides, and then peptides are put together, which make proteins, a full, complete protein. So we're talking about this middle layer, these phrases, these peptides. They're naturally found in the body, and they create signals for the body. And there's been quite a bit of research around these signals and identifying what the signals do. And so the FDA has created categories for these peptides, and the peptides can be mass produced and actually put into an injection form and put into rats and mice for them to study. And they've been doing this over 20 and 30 years. And they've got a list now of quite a few different peptides that have been tested only in research facilities for animals, for mammals, and then eventually into human studies. And a couple of years ago, actually more than a couple of years ago, the FDA created different categories for these types of medications. There's a category 2 and a category 1. The category 2 essentially means this is for research only. You have to be an approved research facility. You can obtain these and you can do research with these. That research can be in animals, it can be in humans, but it's all research-based. And when it's done that way, it's not, those cannot be formulated in a compounding pharmacy. They must be done in a research pharmacy. And that's category 2. And then there's category 1. Category 1 is these peptides can be formulated in a compounding pharmacy, and with a prescription from a provider, they can be used in humans. Now, that doesn't mean it's an FDA-approved medication. It's still off-label use, it's still experimental use, but it can be done, and it can be done through compounding pharmacies. Well, a couple of years ago, there was a move during the Biden administration to remove peptides from compounding pharmacies to be able to actually produce them. And they moved it, they were in a category 1, and then they decided to actually put them into a category 2. And the members who actually made this decision is an FDA subcommittee called the Pharmacy Compounding Advisory Committee. And that committee during the administration said, you know what, all these peptides, they need to be pulled off from category 1 where they're being used off-label and experimental with doctors' prescriptions and being used through compounding pharmacies. We need to take them and just put them back into research again. And the concern was that decision was influenced by others, perhaps big pharma, wanting to create medications that would be much more profitable, but also more studied. And recently the FDA has come back and said, you know what, that committee that made the decision to make all these peptides move from a category 1 where they were being used now to a category 2 only can be used for research. They removed that stipulation, said they're no longer category 2, but they didn't make them category 1. So right now, as of April, they have gone from they're now in limbo, these peptides, and there's about 11 of them, and they do various different things. And I'll kind of talk about that. But right now they're in limbo. And in July, the FDA is going to have another meeting of this pharmacy committee, and they're going to make a recommendation to the FDA, and the FDA normally follows the advice of that committee, and they're going to look to see if they can now move these peptides back into category 1, where your local compounding pharmacy can create these and sell them to patients who have a prescription. It does not make them FDA cleared. It means they can be used off-label for experimental use, but now through just the prescription. And some of the ones are very fascinating. So of these 11, there's a couple that focus on skin. So one actually helps you tan.
Oh.
And while simultaneously helping you tan, it also helps with sexual function, primarily in males. And there's a peptide that does that. There's also one that protects and heals the body that they've used in skin ulcers and ulcerations, and evidently have had tremendous healing and promoting healing in those areas. Same with those who have had perhaps patella tendon ruptures, not complete ruptures, but ones that perhaps would be in a cast for, or a long leg brace for months, using it directly on that site to advance the healing. And they've had results from that as well. There's some that are actually help with super mind alertness and actually can help with the brain fog that many are complaining about these days. So of these 11, there's a number of different utilization. Another one is for deep sleep. So actually using this for patients who have gone off their sleep cycle, or many young teens and early 20s find themselves flipping their cycle of sleep to nighttime versus daytime, using this to actually get that deep restorative sleep and get back on track. So there's a number of uses for these that are very promising and actually were being utilized before they were switched to this category 2. So it's going to be fascinating when they come out in July and make a decision. And if they do make it category 1, they'll become available to the general public. Here's the caveat. So the largest study done on any of these peptides involved one of the peptides around healing. And I want to say it was the TB500, it's the tendon and body recovery peptide. and the largest study done had about 72 patients in it. But they've had multiple studies, multiple phase 2 trials, so adding up to hundreds, maybe thousands of patients, which normally for an FDA-approved medication that you're sure about its safety and viability, et cetera, are tens to hundreds of thousands over time. But also, a lot of times those pharmaceutical companies do many different studies and many of those studies never reach the light of day. So all that to say, we don't have a lot of information on these peptides, but we have some amount. And I think it's very appropriate to move it to that experimental off-label use. And it gives this community who's going to be very interested in longevity and kind of health hacking techniques for us to actually try and make a scientific approach to this and start working together to start to make our own large trials with this. Ideally heading towards perhaps double-blinded, placebo-controlled trials. This will not be done by big pharma with big money. So we have to expect this to have small iterations. But I think that's the only true way we're going to advance these is to do this scientifically rather than, on TikTok this summer, I guarantee you're going to see a lot of advertisements of, hey, you want that super tan and that sexual function like a young person again? Here's your peptide. Yep, $49.95 for your first day and thereafter. So a lot more information on peptides. I think it's an exciting area. I also think there's a lot of room for us to still become much better educated, and we need to study them a lot more.
I'm interested because, well, where are people getting peptides right now who are getting them?
Yeah, so there's a whole gray market that was created. And what is the gray market? The gray market is not the black market. So black market, if you think about anabolic steroids, they are illegal to sell. And yet, when you go to Las Vegas, there's some type of Olympian competition. And if you go there, they are all on anabolic steroids. And where are they getting them? They're getting them from the quote unquote black market. It's illegal and they're buying them and they're just getting them done. Well, when all these peptides were moved from category 1 to category 2, and they could only be sold by or done by research, those research pharmacies are selling this to individuals for quote unquote research purposes. Maybe saying that you can only use these on your lab animals, which your lab animal is your right thigh, and you're taking it and injecting it.
I see.
So you're actually purchasing it that way. And that's the quote unquote gray market. And that gray market was created because they were taken off this. And I mean, that's human ingenuity, and they will do what they're going to do. I do not recommend the gray market by any means, or the black market.
Or doing anything illegal.
Exactly. It is truly a recipe for disaster. Why? Because there was no one telling you exactly what's in that medication that you think you're purchasing, even on the gray market, what the concentration is, how well it was done in that research lab. And I know there's a lot of people out there who will swear by their research pharmacies and they have to follow all their rules and regulations. Yep. But they were never meant to create a gray market. And so if you are hearing about the gray market, I would just say no for right now. Actually, forever. Because there's truly no gray or black. It is truly black or white. It is either legal or not.
And I think for me, when I think of things like peptides, it falls in the category in my brain of like, this is kind of, in my opinion, more of like a last resort kind of thing, because there's so much we just don't know about it. And, yes, it regenerates tissue. Well, where else is it regenerating tissue? Where else is it affecting my body? And a lot of times these studies are done around, I'm looking, I've got my blinders on a lot of times, right? I just want to see, does it help with sleep? Oh my gosh, it helps with sleep. Look at this incredible study that improves your sleep. But we kind of ignored maybe these other side effects that could be happening, or maybe the study wasn't large enough to pick up on that side effect of like, oh, actually, you're really actually a lot dumber after you take these for an extended period of time. And that's just things we don't know yet. Hopefully one day we will. So I think, at least when I approach it with patients, I haven't approached any peptides with any patients, but for similar things of like, hey, I want you to be informed and know like, this is kind of experimental, but we've tried everything else, right? Like you are not sleeping and that is impacting your health significantly. And we've gone through X, Y, and Z. maybe this experimental thing is worth it. Maybe it's worth the risk. And as long as they know that there's risk involved and things we just don't know, then, great, we can try it.
There is a whole community very involved in peptides with deep, deep knowledge here. And it is my hope that as these, however many of these, if not all of them, move to category 1, that knowledge then actually becomes more of a network where they actually start to create, here are the safety and best practices around whom they should use these for, and when it should be utilized, and what is the true evidence behind each one of these, and what are the potential downfalls and negative effects.
Mm-hmm. Absolutely. Well, awesome. Well, this has been so fun.
Yes, I love it. This was great for hot topics with Fiat.
I'm sure we'll do another one on some more hot topics. So if there's something that you want to hear about, then let us know. Shoot us a message, comment, whatever. Send us an email. And we'd love to hear from you and see what else we can chat about. This is great. Thanks, Dr. Ed.
Thank you.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.